Hello, my name is Zidni Zidan Fasya Falik, and today I'm going to talk about anxiety disorder. Everybody knows what it's like to feel anxious. The tensions you feel when your mother is angry, and the way your heart pounds if you are in danger. But first, what is anxiety disorder? Anxiety disorder is a mental health disorder characterized by a feeling of worry, anxiety, or fear that are strong enough to interfere with one's daily activities. Many people still carry on misperception that anxiety disorder are a character flaw, a problem that happens because you are weak. Anxiety disorder are not signs of a character flaw. Most importantly, feeling anxious is not your fault. It is a serious mood disorder which affects a person's ability to function in everyday activities. Anxiety disorder can increase the frequency of symptoms such as headaches, dizziness, and depression. Sufferers can also suffer from digestive and respiratory problems. There are many factors that make anxiety disorders occur, like have a history of trauma, or have had a stressful event, have a family history of generalized anxiety disorder, have a history of disorder of the nervous system. Also, anxiety disorder can happen because someone's needs are not met. People with anxiety disorder usually have the following symptoms: anxiety and excessive worry about a variety of typical conditions, excessive thought about plans and solutions for every possible worst case may not arise, easy to feel irritated, restless, nervous, and cornered, doubtful, afraid, and difficult to make a decision, and hard to concentrate. But don't be easy to diagnose yourself right away if you have symptoms, because then you may be nervous about the disease you are discovering, and this anxiety which may cause you more anxiety disorder. If you experience certain health symptoms, you should ask your doctor about the cause of your health symptoms. So next, after understanding what anxiety disorder is and its causes, how can it be cured? Anxiety disorder can be cured with therapy, drugs, and help from fellow sufferers. Therapy aims to make sufferers recognize and change patterns of thought and behavior that make them feel anxious. This therapy helps patients not to change ordinary thoughts into negative thoughts and able to see them more realistically. Drugs are given to help reduce complaints, but does not guarantee a cure. If the pain returns, then a higher dose is likely to be given. And help from fellow sufferers. It is a method similar to therapy, but does not meet a psychiatrist or psychologist, but meet other sufferers. From the information I found, this could be the best method. I know a story of a general practitioner named Sam Everington. He was visited by many patients with severe depression and anxiety. Patients often experience depression and anxiety for perfectly understandable reasons, such as loneliness. One day, Sam decided to take a different approach. A woman comes to Sam Medical Center. This woman has been locked up in her home for 7 years of crippling depression and anxiety. And when he came to Sam Center, he was told, "Don't worry, we will continue to give you antidepressant, but we will also prescribe other drug. We will prescribe you to come here to the center twice a week to meet a group of people who are depression and anxiety, not to talk about how miserable you are, but to find out something meaningful that you can do together, so that you won't feel lonely and won't feel like life is pointless. The first time this group met, this woman actually started vomiting from anxiety, which overwhelmed her greatly. But people rubbed his back. The group started talking. They talked about gardening, things silly folks can do. They start gardening behind the doctor's office by reading books or watching videos on YouTube. There's a lot of evidence that exposure to the natural world is a very powerful antidepressant. But they're starting to do something more important. They start to form groups. They start to care for each other. If one of them doesn't appear, the other will search for it. Then the woman said, "As the garden began to bloom, we began to bloom too." From this story, there is a conclusion that approaching in a different way by making groups of people who have the same disease make them understand each other. Even those who care about it do not feel that it has helped him to become healthier and possibly be able to recover from his illness. So we have to stop insulting these people by saying they're a sign of weakness or madness or purely biological. We as people who do not suffer from anxiety disorder can help with a different approach like Sam Everington, with bringing together fellow sufferers so that they don't feel lonely and can help each other. From a speaker, I get this word. If you're anxious, you're not weak, you're not crazy, you're not, in the main, a machine with broken parts. You're a human being with unmet needs. Most people say, "Hey, you need to pull yourself together. It's your job to figure out and fix this problem on your own." But what we must say is, we're here as a group to pull together with you. So together, we can figure out and fix this problem. This is what every anxious person needs, and it's what every anxious person deserves. I'm sorry if there is a word or pronunciation that is wrong. I'm still trying to fix it. That's it from me, and thank you for listening to my speech.